So it's an important question because obesity is so common in the general population. So we recognize now from a number of studies in the United States and Europe, for example, that obesity does increase your risk of multiple sclerosis. And we think that's in part related to the fact that our fat tissue, so our adipose tissue, is metabolically active. It secretes pro-inflammatory cytokines and free fatty acids. And so it confers an increased risk of MS. And as you mentioned, it is one of the factors that can increase diagnostic delays. It has also been demonstrated to affect some of the parameters that clinicians seem to follow when we're following people with multiple sclerosis. So brain atrophy seems to be greater in individuals with multiple sclerosis who are obese than not obese. If we're looking at the thickness of the retinal layer in the eye, that also seems to thin more quickly in individuals who are obese, so suggesting some important impacts on outcomes. And in children with multiple sclerosis, a less common group, but nonetheless an important one, there's at least one study that suggests that the response to disease-modifying therapies may not be as good in children who are obese, which may suggest we need to think differently about their treatment. I think it's very important both in terms of, it confers risk, so what could we do to reduce the risk of MS? We could work on obesity, but once somebody is diagnosed with MS, it'll be important to try and help individuals achieve a healthier weight through physical activity and healthy eating, and working with them around the strategies to sustain those behaviors, and trying to prevent it in people who are not obese at the time of diagnosis, trying to head that off from the beginning.